Hello. So for this assignment, I chose to talk a little bit about the use of opioids and the correlation of the pandemic, the COVID-19 pandemic, the stressors about the pandemic, and the use of the opioids. I live in Reno, Nevada, in Washoe County, and our local journal, the Reno Gazette, published on April 22nd of 2021 an article regarding the number of fentanyl-related deaths, stating that it doubled in Washoe County and the correlation uh, due to the pandemic related stresses. And according to the Washoe County Chief Medical Examiner, Laura Knight, in 2019, it was 25 deaths related to the medication. In 2020, the number more than doubled to 56. So that really surprised me. I mean, it's insane. And according to Miss Knight, she stated that people use the drug as a coping mechanism for the stressors that came with the pandemic, such as the change in employment and income, the loss of income in many cases, the housing situation, the health concerns that came with COVID pandemic. And another fact was that the fentanyl is also more available on streets and online than it was 5 years ago. So with that being said, several agencies in Washoe County and the University of Nevada, Reno, started collaborating on a campaign to raise awareness about the consequences of the opioid abuse. And it was a huge boom in 2020 when two high school seniors died after using the pain medication, and after receiving the medical records from the medical examiner's office that it was due to fentanyl. I've been working for Adult Protective Services. Before it was Elder Protective Services, meaning that we were providing services for population 16 and over. And on 2019, July 2019, we changed it to, we received a grant and we were able to start investigating cases of 18 years of age and older, meaning that nowadays our population is older adults and vulnerable people. And on September 2020, we received a grant to educate staff and the community on opioid misuse. And since then, we've been working with the university on collection of data and measures related to opioid misuse. So we developed a screening tool and we improved the process of referring clients to opioid misuse services. And we've been receiving multiple trainings with the university regarding opioid misuse to alert the population about, the crisis that we've been going through. So I thought that this article had everything to do with what we've been working with, and of course with this glass. So that's one of the reasons I chose this one, especially because being a local journal, it feels more real than just choosing something that's also, of course it's real, but not so close to my reality as a social worker here in Reno, Nevada, in Washoe County, where I've been working with this population for the past 7 years now. So, yeah. Well, thank you.